Colon cancer. It's one of the most common yet misunderstood cancers in the world. Every year, it affects over 1 million people, and early detection could be the difference between life and death. In today's video, we're diving deep into colon cancer, what it is, how to spot it early, how it's treated, and most importantly, how you can reduce your risk. Whether you're here to learn for yourself or someone you care about, this video could save a life. What is colon cancer? Colon cancer, also known as colorectal cancer, when it includes the rectum, starts in the large intestine, the last part of your digestive tract. It often begins as small, non-cancerous clumps of cells called polyps. Over time, some of these polyps can become cancerous. That's why regular screening is critical. You can have polyps, even cancer, without feeling any symptoms at first. Causes and risk factors. Like many cancers, colon cancer can be caused by a mix of genetics and lifestyle. Here are some key risk factors you should know. Age. Most cases occur after age 50. Family history, especially if a first-degree relative had it. Diet. High consumption of red or processed meat increases risk. Low fiber, high-fat diet, smoking, and alcohol. Lack of exercise, obesity. Certain genetic conditions like Lynch syndrome or FAP. Good news is, many of these are modifiable. That means you can take action. Symptoms to watch for. Symptoms can be silent at first, but as the cancer progresses, you may notice changes in bowel habits, blood in stool or rectal bleeding, persistent abdominal discomfort, weakness or fatigue, unexplained weight loss, feeling that your bowel doesn't empty completely. These symptoms don't always mean cancer, but they should never be ignored. If you notice them, speak to a doctor. Screening and diagnosis. Colon cancer is one of the most preventable cancers, thanks to effective screening tools. List of common tests. Colonoscopy, gold standard, can detect and remove polyps. Stool tests like FET or Cologuard CT colonography, virtual colonoscopy. Doctors usually recommend starting screening at age 45 or earlier if you have a family history or other risk factors. Treatment options. Treatment depends on the stage of the cancer. Here's a general breakdown. Surgery, to remove cancerous parts of the colon. Chemotherapy, especially if cancer has spread. Radiation therapy, more common in rectal cancer. Targeted therapy, newer drugs that attack specific cancer cells. Immunotherapy, for advanced cases or certain genetic types. The survival rate is much higher when colon cancer is found early. That's why screening and early action are so critical. Prevention tips. You can reduce your risk of colon cancer significantly with a few lifestyle changes. Eat a high-fiber, plant-based diet. Cut down on red and processed meats. Exercise regularly. Maintain a healthy weight. Don't smoke. Limit alcohol. Stay on top of screenings. Simple changes, big impact. Your gut will thank you. Colon cancer is serious, but beatable, especially when caught early. If you're over 45 or have a family history, schedule a screening. Talk to your loved ones. Share this video. You might just save a life. If you found this video helpful, please like, share, and subscribe. Comment below if you have questions or if you've experienced colon cancer in your life. We'd love to hear your story.